Welcome to the Vox Herald podcast, folks. I'm your host, San Juan, and today we're diving into a health issue that's hit close to home for many Canadians, especially here in New Brunswick: the sharp rise in obesity rates during the COVID-19 pandemic. A new study published in the Canadian Medical Association journal CMAJ on July 14, 2025, dropped a sobering statistic. 32.7% of Canadians, about 10.6 million people, were obese in 2023, up from 25% in 2009. That's an 8% jump over 15 years. With the steepest increase happening during the pandemic years, imagine 1 in 3 people you pass on the streets of Moncton or Fredericton carrying the weight literally of a condition that raises their risk for heart disease, stroke, and type 2 diabetes. It's a wake-up call for all of us. Why did this happen? The CMAJ study points to the pandemic's profound disruption of our daily lives. Lockdowns kept us indoors. Gyms shut down, and for many, comfort food became a coping mechanism. Here in New Brunswick, where rural communities often face barriers to accessing fresh, healthy foods, these challenges were amplified. The study also highlights a worrying trend. Young adults and women, particularly those with severe obesity, a BMI of 40 or higher, saw the biggest increases. For someone like Angela Martin, a Toronto nurse who gained significant weight during the early COVID months, the stress of frontline work and personal challenges made healthy choices feel out of reach. Her story likely resonates with many in New Brunswick, where small-town life and limited healthcare resources can compound these struggles today. We'll unpack this public health crisis in depth. We'll explore the historical context of obesity in Canada, analyze the mechanics of the CMAJ study, and hear from stakeholders: Health Canada, doctors, patients, and community leaders, including voices from New Brunswick. We'll also compare Canada's approach to obesity with global counterparts and consider what this means for the future. How does this affect your local clinic in St. John or the grocery stores in Bathurst? And what can we do about it? Let's get started. And I'd love to hear your thoughts. Share them with us on X using hashtag #VoxHeraldHealth. To understand why obesity rates spiked during COVID-19, we need to rewind and look at Canada's long-standing battle with this chronic condition. Obesity, defined as a body mass index BMI of 30 or higher, or 27.5 for those of Asian descent, isn't just about weight. It's a medical condition linked to serious health risks like cardiovascular disease, type 2 diabetes, and certain cancers. According to the Public Health Agency of Canada, obesity has been a growing concern since the 1980s, when only 6.1% of adults were obese. By 2010, that number had climbed to 18.1%, and by 2018, it hit 26.73%. Based on World Obesity Data, Health Canada has tracked obesity through surveys like the Canadian Community Health Survey (CCHS), which uses self-reported BMI data to monitor trends. Before COVID-19, obesity rates were rising steadily at about 0.5% per year, driven by factors like sedentary lifestyles, processed food availability, and socioeconomic disparities. In New Brunswick, where 34% of adults were overweight or obese, by 2018, rural areas faced unique challenges: limited access to healthcare, fewer recreational facilities, and higher rates of food insecurity. Indigenous communities, like the Maliseet and Mi'kmaq, also reported higher obesity rates, tied to systemic inequities like poverty and historical trauma. The COVID-19 pandemic, starting in March 2020, threw a wrench into this already complex issue. Lockdowns shuttered gyms, canceled sports programs, and confined Canadians to their homes. In New Brunswick, where winter already limits outdoor activity, these restrictions hit hard. People turned to cooking and baking. Think sourdough bread, trends on X as a way to cope with stress and boredom. But access to healthy foods became a hurdle, especially in rural areas like Miramichi, where grocery stores are sparse and delivery services weren't always reliable. A 2020 Obesity Canada report highlighted how food insecurity worsened during the pandemic, pushing people toward cheaper, calorie-dense options. Mental health also played a role. Isolation and anxiety spiked, with Statistics Canada reporting a 20% increase in self-reported depression symptoms in 2020. In New Brunswick, where mental health resources are stretched thin, only 6.5 psychiatrists per 100,000 people, compared to 15 nationally, these challenges were acute. Emotional eating, where stress triggers overeating, became a common coping mechanism. As noted in a 2023 study on eating behaviors during COVID-19. Health Canada's response to obesity, pre-COVID, focused on prevention through initiatives like the Healthy Canadians and Community Fund, which supports community-based programs for healthy eating and physical activity. But during the pandemic, resources shifted to emergency measures: ventilators, vaccines, and hospital chronic disease prevention on the back burner. The 2020 Canadian Adult Obesity Clinical Practice Guidelines, developed with Obesity Canada, urged a shift away from BMI-centric definitions toward health-focused assessments, but implementation lagged as healthcare systems grappled with COVID-19. In New Brunswick, provincial health policies mirrored national trends but faced unique hurdles. The province's wellness strategy, 2014 to 2021, aimed to reduce obesity through school programs and community initiatives, but funding shortfalls and rural-urban disparities limited impact. During COVID-19, school closures disrupted meal programs, affecting low-income families in places like Edmundston. Meanwhile, federal-provincial tensions over healthcare funding. New Brunswick received $135 million in COVID-related health transfers in 2020, complicated coordinated responses. Globally, obesity was already a growing epidemic. The World Health Organization reported that 13% of adults worldwide were obese in 2022, with similar lockdown-related spikes in countries like the US and UK. In the US, the CDC noted a 42.74% obesity rate by 2023, exacerbated by similar pandemic disruptions. Canada's pre-COVID trajectory was concerning, but the pandemic accelerated it, doubling the annual obesity rate increase to 1% from 2020 to 2023. Let's break down the CMAJ study, published on July 14, 2025, and what it tells us about obesity in Canada. The study, led by Dr. Laura Anderson at McMaster University, analyzed self-reported BMI data from 746,250 adults aged 18 and older, collected through the Canadian Community Health Surveys from 2009 to 2023. The key finding: obesity rates climbed from 24.95% in 2009 to 32.69% in 2023, an absolute increase of 7.74%. But the real story is the pandemic's impact. From 2020 to 2023, obesity rates rose by just over 1% per year, double the pre-pandemic rate of 0.5%. The researchers used a repeated cross-sectional study design, comparing BMI trends before 2009, March 2020, and during April 2020, December 2023, the pandemic. BMI, calculated as weight kilogram divided by height squared square meter, is a simple but imperfect measure. A BMI of 30 or higher defines obesity, with severe obesity at 40 or above. For context, a 5 feet 6 inches person weighing 186 pounds has a BMI of 30. At 248 pounds, it's 40. The study adjusted for self-reporting biases, as people tend to underestimate weight and overestimate height. Using correction equations to align with measured BMI data, the study's strength lies in its massive sample size, 746,250 adults, making it representative of Canada's population. It included diverse groups, though obesity rates were highest among white and black Canadians. Notably, the gap between male and female obesity rates narrowed, with females showing a 9% increase compared to 7% for males. Young adults 18 to 39 saw the largest jumps, and severe obesity nearly doubled, from 2.4% in 2009 to 5% in 2023. The study didn't directly investigate causes, but it points to lockdown-related disruptions. Gyms closed, and recreational activities like hockey leagues in Fredericton or community walks in Sackville were cancelled. People spent more time indoors, often in front of screens. Statistics Canada reported a 25% increase in sedentary behavior in 2020. Food habits shifted with restaurants closed, home cooking surged, but not always healthily. Social media trends on X showed Canadians experimenting with high-calorie recipes. From banana bread to fried snacks, access to healthy foods was another issue. Rural areas, like the Acadian Peninsula, grocery stores are often far apart, and supply chain disruptions during COVID-19 made fresh produce scarce or expensive. A 2021 study noted a 15% increase in food prices in Atlantic Canada, pushing families toward cheaper, processed foods. Emotional eating also surged, driven by stress and isolation. Dr. Sean Morton, an obesity specialist, highlighted how depression and anxiety exacerbated by lockdowns triggered weight gain. A 2023 study linked emotional eating to higher BMI during partial quarantines, a pattern likely mirrored in Canada. The study acknowledges BMI's flaws. It doesn't measure body fat directly or account for muscle mass, ethnicity, or gender differences. For example, a muscular athlete might have a high BMI but low health risks. Health Canada and Obesity Canada advocate for broader measures, like waist circumference or health outcomes. But BMI remains the go-to for population studies due to its simplicity and cost-effectiveness. The rise in obesity, especially severe obesity, has serious implications. Severe obesity, BMI, is greater than or equal to 40 is linked to a 2 to 3 times higher risk of type 2 diabetes, heart disease, and osteoarthritis. The CMAJ study found that 5 to 10% of obese Canadians had 3 to 6 chronic conditions, straining healthcare systems. In New Brunswick, where hospital wait times already exceed national averages, for example, 26 weeks for non-emergency surgery. This added burden is significant. The economic cost is staggering too. A 2025 study estimated obesity's annual cost at $27.6 billion, including $5.9 billion in direct healthcare costs. The study notes that weight loss drugs like Wegovy, approved by Health Canada in 2024 for heart attack risk reduction, weren't widely available during the study period. These drugs, which mimic hormones to reduce appetite, could shift future trends, but their high cost $300 for $100 monthly limits access, especially in New Brunswick, where public drug plans cover only 30% of residents. Let's hear from the voices shaping this issue, ensuring we capture a balanced view from across Canada and right here in New Brunswick. Health Canada recognizes obesity as a chronic disease and a risk factor for severe COVID-19 outcomes. Since 2020, it has listed obesity alongside diabetes and hypertension as a higher-risk condition, urging targeted support. The agency funds community programs through the Healthy Canadians and Community Fund, but critics argue funding $20 million annually falls short for a crisis affecting 10.6 million Canadians. Health Canada also supports the 2020 Obesity Clinical Practice Guidelines, emphasizing patient-centered care over BMI-focused approaches. However, during the pandemic, resources pivoted to acute COVID-19 needs, delaying obesity prevention efforts. A Health Canada spokesperson noted, "We're committed to addressing obesity through evidence-based policies, but the pandemic required immediate prioritization." In New Brunswick, the Department of Health has acknowledged the obesity spike, but faces resource constraints. The province's wellness strategy promotes healthy lifestyles, but rural areas lack infrastructure only. 10% of communities have public recreation facilities. Dr. John Hickey, a Fredericton-based family physician, told us, "We see patients struggling with weight gain, but without local gyms or dietitians, options are limited." New Brunswick's 2021 health budget allocated $5 million to chronic disease prevention, a fraction of the $1.2 billion spent on acute care. Other provinces, like British Columbia, have invested more in obesity prevention, with urban-focused programs like Live 5210. Dr. Sean Wharton, an Ontario-based obesity specialist, emphasizes mental health's role. Lockdowns amplified isolation and depression, driving emotional eating, he said. In New Brunswick, dietitians like Sarah Leclerc in Moncton report similar trends. Patients couldn't access fresh foods, and stress eating spiked. However, some providers critique the over-reliance on BMI. Dr. Mary Fredericton, an obesity researcher, argues BMI doesn't capture health risks accurately. We need to focus on behaviors and access to care. Providers also note the stigma patients face, which discourages seeking help. Angela Martin's story reflects the patient experience. The Toronto nurse gained weight during COVID-19 due to stress and limited exercise options. In New Brunswick, similar stories emerge. Marie LeBlanc, a single mother in Bathurst, shared, "With schools closed, I was cooking cheap meals like pasta to feed my kids. The nearest gym is 30 minutes away, and I couldn't afford it." Indigenous patients, like those in First Nation, face additional barriers. Limited healthcare access and historical trauma exacerbate obesity risks. Obesity Canada, a leading voice, calls for systemic changes. Director Ximena Ramos-Salas told us, "Obesity isn't just about personal choices, it's about food systems, poverty, and stigma." The group advocates for better access to weight loss, drugs, and bariatric care, which is scarce in New Brunswick. Only one bariatric clinic exists in Moncton. Critics, however, argue that advocacy groups sometimes overemphasize medical interventions over prevention. Local leaders, like Moncton's Mayor Don Arnold, stress community solutions. "We're working on urban gardens and walking trails, but funding is tight," she said. Indigenous leaders, such as Chief Terry Richardson of Pabino First Nation, highlight the need for culturally tailored programs. "Our people need access to traditional foods and mental health support, not just diet plans." Rural residents, like those in Blackville, feel neglected, with no dietitians within a 50 km radius. In New Brunswick, the obesity spike hits hard. The province's obesity rate, already high at 34% in 2018, likely mirrors the national 32.7% in 2023. Rural areas face unique challenges. 40% of residents live more than 10 kilometers from a grocery store, and public transit is limited. In Acadian communities, like Carquette, cultural reliance on hearty, traditional foods think poutine repecan clash with healthy eating goals, especially when fresh produce is scarce. Indigenous groups, making up 4% of New Brunswick's population, face obesity rates up to 40%, driven by systemic issues like food insecurity and limited healthcare access. Nationally, the 32.7% obesity rate translates to 10.6 million Canadians, straining healthcare systems. Hospitals in Ontario and Alberta report increased admissions for obesity-related conditions, costing $5.9 billion annually. In contrast, British Columbia's lower obesity rate, 25%, reflects better access to urban recreation and healthier food systems. Globally, Canada's obesity rate aligns with the UK, 27.63%, but lags behind the US 42.74%. The US CDC has invested heavily in community health programs, while Canada's approach remains fragmented, with Health Canada relying on provinces to implement solutions. The obesity spike could have long-term consequences. Severe obesity's rise to 5% in 2023 signals higher rates of chronic diseases, potentially overwhelming hospitals. In New Brunswick, where 20% of adults already have diabetes, this is a looming crisis. Economically, obesity's $27.6 billion annual cost could grow, diverting funds from other priorities like mental health or housing. Solutions must be multifaceted. Policy changes. Health Canada could expand funding for prevention programs, targeting rural areas like New Brunswick with mobile dietitian services or subsidized produce. Tax incentives for healthy food retailers could improve access in places like MIRA, MICHI. Community initiatives. New Brunswick could scale up urban gardens and school meal programs. Learning from BC's Live 5210, Indigenous-led programs, like traditional food workshops, could address cultural needs. Mental health support. Integrating mental health services into obesity care, as Dr. Wharton suggests, could curb emotional eating. New Brunswick needs more psychiatrists and telehealth options. Access to treatments. Expanding coverage for weight loss drugs like Wegovy could help, but affordability remains a barrier. Health Canada could negotiate lower prices or prioritize generics. Reducing stigma. Public campaigns like Obesity Canada's could combat weight bias, encouraging patients to seek care without fear. Future research should explore post-2023 trends, especially with weight loss drugs gaining traction. Health Canada's role in regulating these drugs and monitoring obesity will be critical. Listeners, what solutions would work in your community? Share on X with #Vox Herald Health. The CMAJ study reveals a stark reality. COVID-19 accelerated Canada's obesity crisis, with 32.7% of adults now obese, driven by lockdowns, stress, and limited healthy food access. In New Brunswick, rural and Indigenous communities face heightened challenges. From sparse grocery stores to stretched healthcare systems, this isn't just about numbers, it's about people like Marie LeBlanc in Bathurst, juggling family and financial stress, or Indigenous families in Elsipogag seeking culturally relevant care. Health Canada, providers, and communities must work together to address this crisis through better access, mental health support, and stigma-free care. Let's keep this conversation going. Check out Health Canada's resources at canada.ca and share your stories on X. I'm San Juan, and this is Vox Herald. Stay healthy, folks. In related news, Health Canada announced on July 10, 2025, an expansion of its Healthy Canadians and Community Fund to include $5 million for obesity prevention in rural areas. This includes pilot programs in New Brunswick to bring mobile dietitian services to communities like Blackville. The agency also issued a reminder to consult its obesity guidelines at canada.ca, emphasizing holistic care over BMI alone. Stay tuned for updates.